I'm Edward Warfield. I'm the publisher of Citybiz. I'm honored today to interview Joe DeMattos, who is the CEO and president of the Health Facilities Association of Maryland. Welcome, Joe.
Edwin, thank you so much for having me.
Can you provide an overview of the Health Facilities Association of Maryland and what is the association's reach and impact?
Well, I appreciate you asking. The Health Facilities Association of Maryland, HFAM, is a nonprofit health trade organization that's been around for about 72 years. We represent the majority of what we grew up calling nursing homes, skilled nursing and rehab centers. We're the largest nationally affiliated organization in Maryland representing nursing homes. And in addition to our 150 nursing home members, we have about 50 assisted living campus members and about 80 associate members who operate in our space, labs, background check companies, security companies, maintenance organizations, and the such.
And so what role has HFM played during COVID?
Well, none of us a year and a half ago would have predicted that we were in the biggest public health crisis since 1918. But I'm very proud of the work of our nursing homes and assisted living campuses and our healthcare heroes. And quite frankly, I'm proud of my team at HFAM. HFAM issued our first COVID alert on January 29, 2020, when most people weren't tracking on what would become the COVID-19 pandemic. We actually took our cue from MedChi, the Maryland Doctors Association, the organization that represents physicians and their community in Maryland. We saw that in early January, MedChi and Maryland physicians were taking this threat very, very seriously. And so we became involved in providing information, advocating, navigating, interacting with government very, very early on. That sped up a bunch in March when Governor Hogan declared a state of emergency in Maryland, and we met with him privately to sort of go over what would likely happen in the weeks and months ahead. So in 2020, we issued over 220 actually sector alerts for healthcare professionals in Maryland, not just HFAM members, not just nursing homes. And we worked pretty much around the clock, especially in March, April, and May, in connecting the dots with government leaders and providers of care in Maryland, and also with our national leaders in Washington, D.C.
The AHCA and NCAL is asking for $100 billion in relief. Can you bring us up to date on the status of that relief fund?
No, that's a great question. Yes, I'm absolutely able to do that. As you know, HFAM is the state affiliate for the American Healthcare Association National Center for Assisted Living, AHCA-NCAL, in Maryland. And their leadership was absolutely pivotal to the $178 billion that were appropriated to Congress and put into the relief fund at the Department of Health and Human Services in the federal government. Of the $178 billion that was appropriated by Congress for aid in those working in healthcare, about $13 billion have been allocated to date to skilled nursing and rehab centers and assisted living campuses across the country. So on the one hand, as part of that HHS fund of $178 billion, nursing homes and the related part of the post-acute long-term care sector have received $13 billion, which is about 7% of that total allocation. We've also at the same time had direct staffing and PPE costs so far in the pandemic of about $30 billion.
And with the declining occupancy and increased expenditures, how is the industry going to respond to these financial challenges?
It's interesting. I think the first thing I would say, Edwin, is to explain to your viewers why there is a decline in occupancy. People enter skilled nursing and rehab centers, nursing homes, after a hospital stay. And in the age of COVID, in hospitals in Maryland and across the country, hospitals have been ordered for periods of time to not do non-emergency medical procedures as a way of reserving space to fight the COVID pandemic. And so those reasons why people would normally enter a nursing home of many ages, younger boomers and older, greater generation folks who have a hospital stay, who would normally enter a nursing home, stay maybe 3 or 4 weeks before going home, those people have not been in the hospital. They haven't had those non-emergency procedures. And so what we're seeing for the first time really in recent history is about a 20% decline in occupancy in skilled nursing and rehab centers, in nursing homes. And nursing homes in Maryland and across the country are paid by the day based on occupancy. So what we have here is very sadly sort of a perfect financial storm. At a time when costs and expenses are going up because of staffing costs, staffing bonuses, PPE, and testing, the occupancy census is going down. And so revenue is going down as costs are going dramatically up. And, ACA NCAL predicts that that will result in some communities across the country in nursing homes closing.
And the pandemic has exacerbated the workforce shortages in long-term health. How's the industry going to address this problem?
We're going to have to be innovative. You teed that question up perfectly, Edwin. COVID-19 has shown a bright light on issues related to healthcare that we've been tracking on and fighting with really for decades. One of them is workforce development across all healthcare settings. We faced pre-COVID in this country a shortage of physicians, a shortage of nurses, and additionally in our sector, a shortage of certified nursing assistants, which we still employ in our sector. That was the case pre-COVID-19. Now with COVID and hopefully in the near future in a new normal, perhaps post-acute COVID, when we get back to some sense of normalcy, those workforce shortages are exacerbated. Older workers in our industry, and by the way, what I'm saying with older workers, I'm talking about tenured employees, people that are in their 40s, 50s, and 60s, not people that are older. People have been absolutely fighting to save lives nonstop for over a year now. And so we have the workforce challenges that we had pre-COVID. And then I think we're going to see a departure of physicians, nurses, and nurses' aides who just frankly have battle fatigue and are going to need to take a break or maybe re-career. And that's going to exacerbate, the challenge. How do we deal with it going forward? The first step is to recognize it. The second step is to look at alternatives. For instance, to what extent with skilled nursing and rehab centers and in our setting, where we rely so heavily on RN supervised, licensed nurse supervised, licensed nurses aides, to what extent in our setting can we take a more European model and train our nurses aides through apprenticeship? The reality is that thousands of nurses aides who had no previous experience volunteered during the pandemic to serve as emergency nurses aides. We've got to look at see how we can retain those emergency hires who earned their stripes as nurses aides fighting the battle against COVID-19. So we're going to have to recognize the problem, acknowledge that it existed before COVID, and look at innovative solutions at overcoming those challenges and that problem.
So in a post-COVID world, how will long-term care change?
Well, one positive aspect, and it's hard to actually acknowledge that there've been positive aspects to our war against COVID-19, but one tremendous positive aspect has been that the genie's out of the bottle with regard to telehealth and televisits. In our country, we struggled with the uptake of telemedicine over the telephone, over video prior to the pandemic. And during the pandemic, it's become the norm and a standard of care. And so going forward, we'll continue to see the use of telemedicine across devices. And that will be really sort of representation of a broadening of the greater integration of healthcare that we were beginning again before the COVID. So post-COVID, you'll see more use of technology. You'll see greater healthcare integration. You'll see more attention being paid to fighting chronic illnesses such as asthma, hypertension, and diabetes, which prove themselves to be really problematic in terms of COVID. People that have chronic healthcare conditions, such as hypertension, diabetes, and asthma, had a higher severity rate and a higher death rate as a result of COVID-19. So you'll see going forward in a world that's not so much post-COVID, but living more actively with COVID, you'll see more telemedicine, more healthcare integration, more energy spent on what we call population health, the social determinants of health, and healthcare disparities.
So is there any part of the HFAM story that you haven't shared with us that you'd like to share?
You know, I'm just really proud of the pictures of the healthcare heroes behind me. They really have, alongside their partners in hospitals, physicians' offices, and other settings, have been fighting to save the lives of Marylanders in need. You know, we see a great deal of press, and it's accurate and appreciated press about those who have unfortunately succumbed to COVID-19. And we have to mourn absolutely every death, but we also have to take the time to celebrate every life saved. I guess two stories that are out there and are acknowledged, but I'd like to highlight is the fact that people that work in skilled nursing and rehab centers in Maryland and across the country have been fighting to save lives. And they've actually saved more lives than not. And sometimes when you see these events honoring healthcare heroes, you rightfully see heroes from hospitals or doctors' offices or other settings, and you rarely see those from our setting. And so I just want to just point that out explicitly and say that I'm proud of all of them. I'll tell you this additionally. One of the secrets to HFAM's success in navigating this pandemic with our members and with the broader sector is the relationship that we had pre-existing with the Maryland Hospital Association and with leaders at hospitals such as LifeBridge and MedStar and Hopkins and Anne Arundel Medical Center and UMS, the University of Maryland system. We saved lives because we knew one another going into the pandemic. And when we were in the trenches, we could connect our respective members and organizations for the benefit of Marylanders in need. So I appreciate the opportunity for the additional question. I guess the two bottom lines is we got to thank the healthcare heroes that work in skilled nursing rehab centers and assisted living, and we've got to thank God for the partnership that we have with the Maryland Hospital Association and as well as the leaders in Maryland's hospitals.
Well, Joe, I want to thank you for joining us today, and I look forward to having a double, if not a triple latte with you.
Looking forward to it. Let's do that.